The initial findings showed a lot of dangerous outcomes for women, primarily cardiovascular outcomes or breast cancer risks, all of which have since been kind of taken back. But these initial findings or interpretation kind of created this fear surrounding hormone replacement therapy. So a lot of providers since then stopped prescribing HRT because they were afraid. But women were still having issues. Women were still having low libido and decreased desire, decreased frequency of sexual events, brain fog, all of the things that come with menopause. So because they weren't able to get HRT, they started going to these other alternative clinics. So there was this space where these alternative clinics really thrived. But the problem was these clinics often use not FDA approved, not evidence-based medicine and kind of go based on symptoms rather than serum values, which can be very dangerous. So our case looked at a woman who had been going to an anti-aging clinic for about 4 years. She had had 16 testosterone pellets put in, and when she presented to us, she had like horrible bloating and weight gain, mood instability, irritability, and her testosterone levels were over 200 times the upper limit of normal for the normal female physiologic range. So super, super high. And again, because she wasn't going to someone who was following like guidelines, evidence-based medicine. So one of the biggest issues is that these compounded hormones are often marketed as safer, but they don't have to go through the same regulatory process. So they don't have to put the safety labels on them, but that doesn't make them safer. It's just because they don't have to do that. And because they're not regulated, the active ingredients in some studies have been found to be like as low as 50% all the way to 200 something percent. So it's just a very broad range. You don't know exactly what you're getting, and you're being told it's safer because they don't have the safety labels, but that's just because they don't have to. So it's not that these drugs are necessarily unsafe, but it's just you're not exactly sure what you're getting because it's not as regulated. So instead of and the pellets are also tricky because once it's in, you can't exactly take it out. So if you're having these super high levels, it's just a very dangerous, it's more dangerous than something that can be titrated more carefully and you can monitor levels versus like guideline based and FDA approved. You can really titrate and monitor levels, monitor symptoms, and be like a little bit more individualized to the patient and careful with what you're doing. I think things to look out for, just any of these negative symptoms like the bloating, the weight gain. Um, Testosterone supplementation hasn't really been studied that much in women. So there's a lot that we don't know. But sort of any of these negative symptoms, red flags, looking at like the serum levels, the total testosterone, as I said, in our patient, it was over 200 times the upper limit of normal. So we know she was in this very super physiologic level. So if you have a patient that presents to the clinic and you see that, of course, that's something to make note of and kind of work with the patient. I think a lot of it comes down to shared decision making, informed consent, really getting patients and clinicians to understand the risks associated with HRT, but also the risks that don't exist that we were once told that exist with HRT. So yeah, kind of finding the balance. This shouldn't be a problem. Like, you really shouldn't be going through testosterone withdrawal if you're staying within this normal level. Because basically, what we're trying to do with hormone replacement therapy is when you go through menopause and all of your hormone levels drop, we want to get them back to the levels they were before menopause. So you shouldn't be going through withdrawal necessarily if you aren't in these like super insane high levels. But in our patient, because she was in this super physiologic level, when we stopped the testosterone, she started having even worse symptoms like mood instability and low libido. She didn't have the more like androgenic symptoms that some people have, like a deepened voice or hair on the face, enlarged clitoris. But withdrawal really hasn't been looked at that all that much in women, so there's a lot again that we don't necessarily know. But yes, she definitely had a lot of withdrawal symptoms, and so we slowly had to reintroduce testosterone because that was why she went on in the first place. She was having these symptoms and she wanted solutions. And then she sort of had to go through a long process to find a happy balance between not being in the super high level, not being withdrawal, and finding like a good even ground. I think this case really just underscores the need for better clinician education. These hormones can be very, very safe if done well, if titrated well. Adherence to guidelines. Guidelines are out there. Ishwish has guidelines for testosterone hormone replacement therapy. And then overall, just like sticking to evidence-based and advocating for evidence-based medicine, because women really do deserve the relief from these symptoms, and testosterone replacement is a wonderful way of getting that relief if done well and done safely.